endocrine diseases and the role of youth in controlling non-communicable diseases epidemic. Now, without any further delay, I would like to welcome Dr. Venkatesh Karthikeyan, Sir, General Secretary of IMA Juniors Doctor Network, Tamil Nadu. Sir, please take over and proceed with this webinar.
Thank you so much, Batul. Very good evening, everyone. Apologies for the delay. So this is Dr. Venkatesh Karthikeyan, Community and Family Medicine Postgraduate Resident from AIIMS Patna. I'm extremely delighted to welcome all our 1,800 plus registered participants who have joined from different parts of the world. As doctors, we are aware that the disease trend is slowly shifting from communicable diseases to non-communicable diseases, and these NCDs threaten the progress towards the 2030 Agenda for Sustainable Development, which includes a target of reducing premature deaths from NCDs by 1/3 in the year 2020. None can deny that an important way to control NCDs is to focus on reducing the risk factors associated with these diseases. Low-cost solutions exist for governments and other stakeholders to reduce the common modifiable risk factors. One such solution is front-of-package labeling. Hence, Indian Medical Association Junior Doctors Network is organizing this webinar under the able guidance of senior leaders like Dr. Ravi Venkatesh sir, Dr. Jailal sir, Dr. Sajanand sir, Dr. Jayesh Lele sir, Dr. Shijit sir, and Dr. Parul ma'am. We are thankful to Dr. Pradeep Agarwal sir from AIIMS Rishikesh and Dr. Om Prakash sir from Global Health Advocacy Incubator for facilitating this important webinar. We have dynamic speakers with us like Professor Dr. CM Singh sir from AIIMS Patna, Dr. Pankaj Bharadwaj sir from AIIMS Jodhpur, Dr. Sunila Garg ma'am from IAPSM, Dr. Madhukar Mittal sir from AIIMS Jodhpur, and Dr. Shiv Joshi sir from World Medical Association Junior Doctors Network. I'm pretty sure that the next 1 hour is going to be an academic feast for all of us. Now, I'm honored to welcome a leader who is always there for young doctors, be it NEET-PG issue, be it the issue faced due to counseling, be it the issues on violence against doctors, whatever problems the young doctors face, we have a leader to give voice for us. It is none other than Professor Dr. Jailal sir, the immediate past national president of Indian Medical Association. IMA-JDN has witnessed a golden phase under Dr. Jailal sir's tenure, where Sir has never said a no to any of our JDN initiatives. He has always been kind enough and extremely supportive to our junior doctors. Thank you so much, sir, for accepting our invitation. Now, I kindly request Dr. Jailal sir to welcome our participants and the panelists. Over to you, sir. Sir, kindly unmute, sir.
Thank you very much, Venkatesh. I'm extremely happy and delighted to know that the tremendous work as a junior doctor, as a postgraduate resident, you are doing on the various important issues, both for empowering our doctors and the young graduates on the research methodology, social preventive aspect, and also now you have taken up a very important issue. I'm sure the list of panelists which we have brought in will be definitely add color to this important meeting. I am extremely happy, and as a immediate past president of Indian Medical Association, for inviting and welcome the learned speakers for this important session. I know for sure that each one of them, Dr. Sunil and all other people, the contribution they have given for the various important issues, whether it is a vaccination drive, whether it is an issue related to the tuberculosis control, or many issues. And always these people will raise their voice and consciously, and in this one of the very important topic which we have chosen, I think definitely they will be able to give much better views and ideas into that. And as this concept of the front level package is coming into I think as an Indian culture and Indian concept, there is a lot of things that we need to go forward. It is one of the important steps which we are taking. We may not be able to reap the benefit immediately, but sure that sustainability, when we can maintain, we will be able to reach somewhere region. I always remember the biomedical waste concept when it was evaluated 10 years back. And none of us believed that this will be able to have such a great impact in the hospital. Now today, and we are proud, at least 80 to 90% of our hospitals are able to do the segregation at source and labeling it in a proper way. So it takes time. But similarly, I am sure this concept of the package labeling will definitely give a view. There are a lot of critics will come. The people will not read. the language will be a problem, and whatever you put that people are not going to be changed. But I'm sure slowly, and when we are able to make this concept very clear into the mind of the people, definitely there is a possibility of a change. Because what we are seeing today, the obesity or any NCD, it is not that the uneducated people, it is not the people from the rural area, it is invariably the people from the metropolitan city, the well-known people, the children come into the school, and they are the breeding place. So we cannot take the illiteracy of India will be the hampering for the front package package, because the disease per se affects mainly the people who are in the higher end area, or the educated people where they can be able to read. So when if we can do this concept of the making it prominent whenever they are taking the food, and then the people are able to note that. Now, if we did recently a survey was done, and how many people really look into the expiry dates in the fruit product. And in one of the supermarket, the study was conducted. And surprisingly, we could see almost 76 to 70, I mean, almost 80% of the people who are coming to the markets or the big mall, they were looking into the product and they are looking into the expiry date. So that one concept has come to the mind of the people, and definitely I am confident if the food package, front page labeling is also there, slowly the people will be able to look into that and get to know about that. Many times when we take the food and we are not able to see what exactly it contains and how it is been processed, the only issue we will face is the GST issue will now come, because unpacked food will no GST, and when it is a packed, it is going to add on to the GST. So the more and more the foods are going to come in an unpacked way, the more and more the nutrients are going to be there in an unpacked way. I think as an organization, as a people, that we should also make this a concept known to the government, that when you make such a drastic difference in the packed and unpacked food, the impact it is going to have as an unpacked food on the people are also going to be high. That is, you can't put a GST for food nutrients or the food items, which is going to have a long impact on the body. So that is one area where I thought this will be an issue. But all other issues, like second most companies, whenever we file a agreement with the bank, and there will be a lot of things will be written, and finally we have to sign. And most of us will not read the content in the bank agreements or the passbook, and will sign it because it is in a very small letter and it is not in a way it is going to be readable. But this front package label should be in a way it is catchy, it is attractive, it is eye-catching or impressive on that. People can do that. When there was an issue on the cigarette packing, with the 80% the labeling was there, there were hue and cry came from the cigarette manufacturers that they wanted to reduce the package level or the impact for the 50%. But consistently, Indian Medical Association fought for that. Even we gone to the order stating that the statutory warning which is put on the cigarette pack should not be reduced, and it should be more catchy. It should be 80% of the package should cover that area. So similarly, I think this concept will be definitely going to help us because we know for sure only the 4 habits are going to make us the obesity, the food which we are taking, and the cigarette and alcohol. There's a lot of efforts on alcohol and cigarette has been already been done. But now the 3rd and 4th is the food package and the junk foods, which we need to have a much more effort. I'm confident once again because it is being taken up by the Junior Doctor Network. Because you are the pioneers, you are the ambassadors, you are the people who are going to change the concept of people. Doctor is going to think how we are going to make it. So along with the FSSI, IMA, JDN, and the learned people, and definitely that you will be able to make a great change in the society for the goodness of the people, for the goodness of it. If we can save at least one person from knowingly that he is not going to take the food or avoid the which are not good for the health, it is a great job. So always, I like this way of working by the JDN or the frontliners for us. You are there to be a torch bearer. You are the people going to give us the new vision and the new ideas and new look into the way in which we need to work. So I congratulate once again Dr. Parul, Dr. Srijit, Dr. Karthik, and Shivajoshi is here, the international fellow is here. So all of you will be able to some initiative. I take this opportunity to welcome, congratulate, and appreciate all the learned speakers and all the organizers, and especially Venkatesh for this wonderful initiative. Thank you very much, Venkatesh.
Thank you so much, sir, for the kind words and for enlightening us the importance of this topic. You have beautifully highlighted the potential challenges also in the front of package labeling, sir. Thank you so much once again, sir. I'm delighted and privileged to welcome our keynote speaker, Professor Dr. C.M. Singh, sir. Sir is the medical superintendent and head of Department of Community and Family Medicine, AIIMS Patna. Sir has contributed immensely to the scientific community with more than 68 research publications in reputed journals, including the Lancet. He has been the PI and co-PI in more than 100 projects of public health importance. He has a vast teaching and research experience of more than 22 years. He is the Vice President of Indian Public Health Association and has been the Chief Advisor and Editor for many reputed journals like IJCH. Sir has extensively worked in the area of NCDs and nutrition, and he is a part of the advisory group Healthy Food for All. Thanks a lot for accepting our invitation, sir. Now I request Professor Dr. C.M. Singh, sir, to kindly share a few words with us. Sir, you're muted, sir.
Thank you, Venkatesh. Good evening, Pankaj. Good evening, Dr. Pradeep. Good evening, all the organizers and speakers. I'm happy to be a part of this webinar on a very important topic, front of package labeling as a policy intervention for bending down the NCD curve in India, especially among the youth. Since most of you, many connected people are youth, it is very important that we should know about the disadvantage of front of package labeling, how it is contributing for NCD and all those things. We all know that the resident doctors are the backbone of any institution, and they work round the clock. Many times they end up doing late night duty as well. These hours of working for the young doctors have made them vulnerable as they end up eating junk food, which many a time is the only food available to them in the late hours. This in turn is a potential threat to their health as this increases the risk of NCD like cardiovascular disease among young doctors. As we know, India is a country that is privileged to have a very dynamic youth population, and we train several thousands of doctors every year. It's our duty to promote healthy eating habit among the young doctors of our country so that they can serve the patients and nation better. In this direction, I see front of package labeling as an important strategy to bring down the NCD incidence in youth. I feel that it is our responsibility to educate our juniors and promote healthy eating habits among all the juniors. I see this webinar by Indian Medical Association Junior Doctors Network as a great initiative to sail towards the creating the awareness and facilitate appropriate policy changes. I congratulate and thanks Professor Dr. Ravi Venkatesh, Treasurer of World Medical Association, and Professor Dr. Jailal, past President of Indian Medical Association, for supporting these kind of awareness activity, which is hugely beneficial for young doctors. World Health Organization says that more than 70% of deaths across the world are due to NCD, and nearly half of these are the premature deaths. We also need to note that more than 75% of these NCD deaths are from low and middle income countries like India. So the role of creating awareness among the youth of our nation and working towards policy changes gains a greater significance. So to cut down the NCD burden, especially among youth, front of package labeling is important and powerful tool. I could see that we have a wonderful speaker like Professor Sunila Garg ma'am, past president of IAPSM, Dr. Pankaj Bhardwaj, my colleague from AIIMS Jodhpur, Dr. Madhukar Mittal, Dr. Siva Joshi, Dr. Om Prakash, and Dr. Pradeep Agrawal from AIIMS Rishikesh. And we all know he is very much involved in front of in policy change of front of package labeling. I once again appreciate the IMA Junior Doctors Network, Dr. Om Prakash, Dr. Pradeep Agrawal, and the speakers for taking up this important topic for discussion. Like the audience, I am also eager to listen to our speakers and learn from them. Thank you organizers once again. Thank you, Karthik. Thank you for inviting me, and thank you everyone.
Thank you so much, sir, for sparing your busy time, busy schedule. We have amongst your busy schedule, you have spared time for us. Thank you so much, sir, for joining. Now,
Thank
to
you,
give
sir.
us more, thank you, sir. To give us more clarity about the significance of this topic, we have Dr. Pankaj Bharadwaj, sir, to talk on the burden of NCDs in youths of India. Sir is the Dean of Research and Additional Professor of the Department of Community Medicine and Family Medicine, AIIMS Jodhpur. Sir is the Nodal Officer of Adult Vaccination Center and Coordinator of School of Public Health, AIIMS Jodhpur. He is also the Chief Editor of Indian Journal of Community Medicine and has many research publications to his credit. With this very short intro, I would like to request Dr. Pankaj Bharadwaj, sir, to please take over the session.
Thank you, Venkatesh, and thanks all for the opportunity. I think I should give my regards from All India Institute of Medical Sciences, Jodhpur, to the organizers for this opportunity, to Professor Ravi Vankhetkar and Dr. Jayalal and all IMA people, along with my all co-speakers. So I'll be very brief because I'll be entrusted with the responsibility of having the burden. So I would like to share my screen now, and Venkatesh, please help me to know whether it is visible or not. Are
Yes,
my
sir.
slides visible?
Yes, sir. Yes, sir. Perfect.
Great. So for the next 3, 4, 5 minutes, what I will do is that I'll take you to the burden of NCDs in though it's youth, but we all know that in different part, I'll try to cover up as far as possible that what's the current burden of NCD disease. So if you look at the World Health Organization data, as Professor C.M. Singh was also saying, and Professor Jayalal was also saying, that it is actually the NCD which is killing more number of people than the communicable disease. Though 2019 and after 2020, COVID-19 has taken a kind of an attention from NCD to CD, but still the data, as we know, is more towards the NCD, which as per the WHO or CDC. So each year, if you look at the kind of age bracket, it's the youth actually 30 to 69 years of age group, where we find that the 15 million or over 15 million people are dying due to NCD. And as Professor C.M. Singh was telling, that it's about 85% of them are from the low or middle income countries. So that gives a kind of a value to this, that these are those countries where there is a case of food insecurity also, as well as, there are the other burdens also. So if we look at the kind of the risk factors which led to these NCDs, these are tobacco or substance use, physical inactivity, and unhealthy diets. And I'll take you to the next slide where you find that Gate survey showing that now the incidence or the kind of a prevalence of substance abuse is being decreasing. So it's more towards the unhealthy diet. I think this seminar or webinar today will address that FOPL issue more, because that's the most important part which we are finding today. So if you look at this clip art, which I try to show, is these are the 3 important factors. One is the kind of the lifestyle, which is the sedentary lifestyle, the kind of food which we are taking in terms of what we call as the fast food, or what we call as this kind of food. Though we always say it's not about fast, it's about junk food which has been happening, and the kind of the obesity, which is a kind of a risk factor. So if you look at the data which International Diabetic Foundation produces, it says that India is currently having 15% of Indian children as obese, and which is actually second to China only. And if you look at the kind of a diabetic, incidence or prevalence, it is around 73 million diabetic cases, which is again next to China. The unfortunate part is that we are actually having this projection that by 2045, the number is going to be doubled, and it's around 134 million. And the kind of deaths which we propose, or which we actually estimated, and which found to be true in 2019 were 15 lakh deaths due to diabetes. And it was a 5% increase in just 16 years, which we've seen in India. So when we say NCD, as Professor Jayalal was saying, that NCDs more or less are the 4 which we say about the cardiovascular causes, which is around the 50% of the entire burden of NCD, and around 1/4, which is from the respiratory, 12% cancers, and around diabetes. If you look at the hypertension prevalence, as I was about to speak on the numbers game only, it's around 220 million people with hypertension. We all know about the rules of halves, and rule of half says that you cut off to half, 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 and half. And we all know that it's just 12% of the people in world where we find that they are actually having their hypertension controlled. If you look at the kind of daily losses from 1990 to 2016, we find that it is about diabetes and the IHD or cardiovascular causes. Now, those states, I'll come to those states also, which are giving more numbers, as Professor Jailal was saying, are from those states which are considered to be the not from the empowered action group, but are the high performing states in terms of the health statistics. So these are from the state of Punjab or the southern states or the central or western part of country. And as we all know that currently a new entity has been emerged, which is by the name of NAFLD, or non-alcoholic fatty liver disease, which is also being added to these non-communicable diseases, where the prevalence is increasing so far. When I was a student 27 years back, then we were taught only this thing in medicine schools, that if you are having a case of liver cirrhosis or fatty liver, it is mostly due to alcoholism. But now we are finding that it's more about the diet, or it's more about the lifestyle, or more about the kind of these risk factors which are actually adding the risk of fatty liver and also liver cirrhosis. So if you look at the kind of a transition from 1990 to 2016, you can see the kind of greenness which has been coming down. Green means these communicable disease, and those yellow, which is actually the non-communicable disease burden, where you are finding that this green pie is half. So almost half is in these 20 years or 30 odd years, you are finding that it's been half, and this yellowness or this NCD prevalence is increasing. If you look at the prevalence of major non-communicable disease as per the data which has been available so far, you can see that the prevalence data, if you look at the y-axis, it's about the 6.75%. It's been increasing more in chronic kidney diseases, and which is followed by the chronic respiratory diseases, cardiovascular diseases, diabetes, and stroke. And you can see that the kind of graph is increasing cumulatively every year, increasing the prevalence of non-communicable disease. Have a look on the cancers. As we know that the risk factors in non-communicable diseases are common. You can see and you can have a look on the prevalence of breast cancers and oral and cervical cancers, which is increasingly day by day the data as shown in the trend. Now, as NFHS is, or National Family Health Survey, is an important survey agency which tells us about how we are moving ahead. If you look at the male and female prevalence of hypertension and diabetes, you can see that the gap is being decreasing very fast. Because earlier, if you remember, we always say that one of the risk factors is the male gender, which adds to the risk of hypertension and diabetes. But you can see that this gap is being decreasing every year, and NFHS is showing that it has been increased from 13.6 to 21.4 in males and 8.8 to 17.6, almost double in female genders, both in hypertension as well as in diabetes mellitus. If you look at the cases in overweight and obese, we know that female gender is having more risk of getting obese. So you can see the similar trend is also being there. It's an interesting slide which I would like to show to my colleagues, is about tobacco and alcohol use, where you are finding that when we were talking in our first or second slide about the risk factors, and they were substance abuse, the sedentary lifestyle, and diet, we can see that GET survey is showing that now day by day, the kind of an incidence or the kind of a prevalence of getting the substance abuse among youth is decreasing. And we need to understand that there are other factors like diet which need to be addressed now along with the substance abuse. Now, this is a very interesting slide. You can see this is a kind of epidemiological transition where we are actually showing the kind of communicable versus non-communicable. So it's a kind of a index which we say communicable upon non-communicable diseases. And you can see that in 1990, the entire central India is in red color, which means that communicable diseases are more and non-communicable are less, but they are actually turning out into blue. In 2016, that means now the non-communicable diseases are increasing. You can see it's the ratio which is less than 1. Even in states like empowered action states of Uttar Pradesh, Rajasthan, Bihar, where now the load of non-communicable disease is increasing. And as Professor Jailal was saying, that it's more towards those states which are actually good states, supposed to be good states in all indicators, like Kerala, Tamil Nadu, or southern states of the country, or high in Punjab, where we are finding that the incidence of NCD is increasing. The similar pattern is being seen in other, like ischemic heart disease. Yes, definitely the kind of load in chronic obstructive pulmonary disease is a bit similar to the communicable disease, because of the factors we know that in empowered action states, actually it is more in comparison to those where the non-communicable disease are there. I think this is my last slide, because my role was to set the ball rolling and to get more insight about the issues of FOPL in our country, and just to set the stage with the data of numbers. But at the end, I would like to say with the last slide that government is also now having different initiatives to address the issues of non-communicable diseases with the launch of multi-sectoral action plan for prevention and control of NCDs. We have initiatives which are specifically addressing the hypertension with IHCI guidelines, where they are working hard towards the stroke registry program, and also the incorporation of NAFLD in the NPCDCS program. And last but not the least, I think the entire next sessions would be dedicated to this important part of FOPL, where the FSSAI have come up with the drafts of new labeling and display regulations 2019. And I think that is a very important part, which I would also be interested to know, that how these different labeling display regulations 2019 are being launched, or they are being planned to be launched in our country. Thank you all for a patient hearing, and thanks to the organizers for giving me this opportunity. Thank you so much.
Thank you so much, sir, for beautifully highlighting the burden of NCDs in a very comprehensive way. Thanks a lot, sir, for joining us. Moving on, we have our next speaker to talk on the role of youth in controlling NCD epidemic. For this, I take immense pleasure in welcoming my mentor, Dr. Shiv Joshi, sir. Sir is a MD Community Medicine Senior Resident, former National Convener of IMA Junior Doctors Network, National President of UNESCO Chair in Bioethics, and currently working closely with the World Medical Association Junior Doctors Network. Being a public health professional who is a fresh postgraduate by himself and representing young doctors of our country in a global platform like World Medical Association, Dr. Shiv Joshi, sir, is the best person to talk on this topic. We are very eager to learn from you, sir. Welcome, sir.
Thanks a lot, Venkatesh, and thank you for having me here. It's a very important topic that we're talking about, the role of youth in controlling NCDs. I'd like to share a few slides. They're technically just 5 slides. So, Venkatesh, would you allow me to share my screen? Should I go ahead and share my screen?
Yes, sir, please.
All right, great. Thanks. Please just let me know if you can see my screen.
Yes, sir, it is visible.
Visible? Okay,
yes.
Thank you. Thank you. So, as already mentioned by Venkatesh, we are going to talk about a very important topic here, that is the role of youth in controlling non-communicable diseases. When we look at the youth, we start by defining who the youth are. And if we look at our national youth policy, which was launched in 2014 from the Government of India, Ministry of Youth Affairs, they have labeled individuals aged 15 to 29 as the youth in India. And this age group constitutes around 27.5% of India's population. So it's almost a third of India's population that falls into this category. If we go to the census findings, the latest census of 2011, 563 million people, young people, the word used was young people at that time, 10 to 35 years, were there in India, which is quite a large number. So if we look at the non-communicable diseases and youth, there are certain glaring aspects that we need to understand. We need to understand that the youth is not just 1/3 of India, and it's not just a very significant population across the globe, but it is also a very large portion of the global NCD burden. And because such a situation is there, we also need to appreciate that the risks young people face earlier in their life can also impact their NCD burden later in the life. And as we always mention that if we act early, we will, so early diagnosis that we usually refer to in the secondary prevention, the level of prevention that we talk about always, it is more effective if we do it in the youth, so as to prevent the burden of NCDs from skyrocketing in the later years of life. It is also important to understand that 2/3 of the premature deaths in adults are associated with childhood conditions or behaviors which are initiated during the youth years. These behaviors could be something like starting smoking, or it can be regarding the lack of physical activity. It can be a number of other things too. And there are over, if we go by the numbers, there are globally over 150 million young people are smoking. Around 81% of our adolescents do not get enough physical activity. Around 12% of adolescents partake in heavy episodic drinking, and 41 million children under 5 years old are obese or overweight. So if we look at the young people, they suffer from non-communicable diseases that not only have the environmental or socioeconomic factors, but also some congenital factors in their childhood, which then affect them in the youth. So the spectrum of non-communicable diseases and youth is very broad. And a lot of these diseases, if they do not affect the youth directly, a lot of the factors that will cause NCDs, they arise during the youth period. And that's why we are thinking about how to utilize youth in controlling the non-communicable disease. The first thing that comes to my mind is like, who else can most effectively communicate to youth than the youth themselves? So let's say if there is a person going from outside the community and telling people not to smoke or do physical activity, it is very less likely, like as humans, we have this tendency, unless and until we perceive something as a threat, we will not change our behavior, right? So who else can be more effective in communicating to the youth than the youth themselves, who have been in such a practice or who have brought themselves out of a practice that was affecting their behavior, behavior that was affecting their health. For example, smoking or dietary patterns or physical activity, such things. Young people are also open to learning. They're highly resourceful because of the curiosity, inquisitiveness that exists in the young people. And also they are awesome multitaskers. I put them deliberately in the single quotes because a lot of us believe that there's nothing like multitasking. We are just good at shifting tasks in an efficient manner. A lot of youth, if we see, are inherently passionate, they're inquisitive, and they are good kind of multitaskers. What we can do, like, because we have these characteristics of youth with us, we can use or utilize the youth as champion ambassadors for the government programs at the community level. Bringing into the Indian perspective, the youth can act as a strong voice for change in the community because they are the community themselves. They are 1/3 of the country. They are 1/3 of the population. They can become a strong voice for change in the community. This strong voice is essential to share information about non-communicable diseases as well as to promote awareness regarding a balanced and healthy lifestyle. So it's very likely to enforce some kind of behavior change if youth, some celebrity in the youth is coming forward with some venture talking about yoga or talking about lifestyle modifications, talking about no to cigarette smoking or things like that. It creates an impact if the youth themselves come ahead and do such activities. If we want to look at one of the examples in India where the government of India is engaging youth, is the Rashtriya Kishore Swasthya Karyakram, or as we know, RKSK, where the program's focus area is on nutrition, sexual and reproductive health, a peer educator model, which is still under testing. However, it is an initiative, an innovation, I would say, where youth is being incorporated to create the behavioral change that will prevent the non-communicable diseases in the later years of life. We have also seen that involving youth as champion ambassadors can help in the non-communicable disease prevention. Because we are incorporating this youth who are coming from the same community, we are also in a manner building trust between the communities as well as the government regarding what services the government is providing. Essentially, as the last section of my today's session, youths can act as advocates at a grassroots level, and this comes from a research done in India itself. And the researchers have found that like young people can hold the government accountable because young people, they're inquisitive, they are forward, I mean straightforward. They can they have that they have enough passion to hold the government accountable regarding what kind of promises they made regarding NCD programs or NCD screening or kind of activities that should happen in their own communities. However, to make this happen, the essential aspect remains for the youth to become translators of reliable information. So youth can hold the government accountable for its schemes, for its provisions, for the services, only if the youth themselves are translators of reliable information. And how does that happen? For that to happen, we need to understand a process that needs to follow. To make that level of translation possible, that level of information with the youth available, it is only possible if they have enough knowledge and some experience with regard to non-communicable diseases. And how do you do that? We do it by incorporating the non-communicable diseases in the school and the college science curriculum, so that every student of a school as well as college is aware about what the non-communicable diseases are, what are the related risk factors. It will help youth make informed choices on healthy lifestyles. And because now they are informed and making good lifestyle decisions, they also are able now to disseminate these learnings to people around them, their own family members, their friends who are not aware about it. So people around them, basically. This would in turn promote the access to reliable information to the communities regarding services that are being provided by the government, eventually leading to lowering the disease burden. So if we look at the youth as advocates at the grassroots levels, it is theoretically, it is a set path. However, at multiple steps, a lot needs to be still done in order to encourage the participation of youth at the level of these policies. That is something which the seniors in the policy making have recognized and need to reinforce the need of involvement of youth in such policies. That's all from my end, Venkatesh. Thank you for having me.
Thanks a lot, sir, for such a short and sweet talk, highlighting the role of youth in controlling NCD. Thank you once again, sir. Now, I request Dr. Madhukar Mittal, sir, Additional Professor at the Department of Endocrinology and Metabolism, AIIMS Jodhpur, to enlighten us about the emerging endocrine diseases in the youth of India. Welcome, sir. Sir, kindly unmute yourself, sir.
Thank you, Venkatesh, and thank you to the organizers, Dr. Pradeep Agarwal, Professor Wankhedkar, and Dr. Jailal for providing this platform. I'll just try and share my screen. Is it visible?
Yes, sir, it is. It is visible.
So I think Dr. Sunila Garg ma'am will be taking on the role of FOPL. So, and Dr. Pankaj and Dr. Shiv Joshi have sort of set the stage, and I'll be addressing the emerging endocrine diseases, especially with the focus on use through the awareness on front of package labeling. So I'll just sort of give a brief overview in what Dr. Pankaj had mentioned in his opening remarks with regards to the burden of the diabetic population exploding in India over the next 2 or 3 decades. Even India will sort of be overtaking as the diabetic capital of the world. This is precisely what is going to happen for the reason because there is a difference in the prevalence of diabetes happening in India as compared to the Western population. We know that diabetes and cardiovascular disease are occurring at a much, much younger age as compared to the Western population. And also with improved sort of sanitation, there are less infectious diseases happening. as Dr. Pankaj alluded to. So what is going to happen that all the younger population, which sort of gets into the trap of the developing non-communicable diseases, including diabetes or diabesity, diabetes and obesity, they are all going to live longer lives with the conditions of diabetes and obesity. So the burden is going to dramatically increase and these numbers are going to explode. So this is one of the factors. Second, with regards to what we have seen during this COVID pandemic also, the population which was sort of more exposed to a higher morbidity and mortality were the individuals who had an underlying conditions of non-communicable diseases. So patients with diabetes, obesity, cardiovascular disease, chronic kidney disease was the population which sort of fell prey. They had higher mortality, they had higher hospital stays, they were staying more of in the ICUs. So that was another factor. So these people or these individuals with diabetes and obesity are actually going to be predisposed to more and more infectious disease and are more likely to succumb to these. So we need to make our youth aware to stay away from these non-communicable diseases. And the best way to do that is to bringing a societal change into the aspects of preventing these lifestyle disorders by sort of changing our lifestyle habits. And I think what Dr. Pradeep is taking forward and what the government is sort of proposed with regards to front of package labeling is the way forward. So we have this Codex Alimentarius, and I think this will be taken in the subsequent sessions. But what I want to emphasize is that this nutrition information, bringing it from the back to the front, is what will be the key to changing lifestyle habits and people making healthier choices and overall improvement in the nutrition of our youth, which is what is going to lead the change and taking these people away from non-communicable diseases, including the epidemic of diabetes. So what is happening is the health halo effect in the current scenario, where marketers and industry are putting sort of a good part. So maybe there are vitamins there and they'll put those vitamins right in the front and highlight it, while all the aspects which are sort of high cholesterol, high sugars, high salt, they'll be written at the back in small letters. So what makes the youth attracted is the large labels in front, and that's what the health or halo effect, which is driving a lot of our youth to choosing or making unhealthy choices. This is what it looks like, small right at the back. And if we can sort of make this change happen, and that is where FOPL becomes so important, that it will enable our youth to make informed and healthier choices in a timely fashion. It will save a lot of time because we know that it takes a lot of time. And in fact, many people are not able to read those small letters right at the back. So this labeling can actually influence not only the consumers, but also can lead gradually over time to the industry to sort of improve their standards of food, what they are bringing. And with regards to this, especially the nutrient specific warning labels would become so important to highlight the negative aspects of these foods which are there. So that is where we have to keep in mind, and the success or effectiveness would depend on what type of food labeling system we choose, because the youth, we know, get attracted. I mean, it's normal human tendency, not even youth, everybody would get attracted to sort of what is right in the front, large font, attractive fonts, rather than those small letters right at the back. And we just in the last session discussed that youth are sort of aware with regards to multifaceted tasks. They are more prone to bring about change. So bringing food labels which are interpretative for would be also sort of more helpful for these youth. However, we need to keep in mind in India, where people may not be so aware of the various foods and they spend less time in the reading those labels, then maybe non-interpretative food labels can also be incorporated. Now, with regards to the addressing these emerging endocrine disorders, we know that these current ultra-processed foods, they are available increasingly. We know obesity, diabetes, hypertension, and cardiovascular disease is occurring because of the significant amount of consumption of these ultra-processed food products. We have data from 2016 where 1.9 billion individuals are estimated to have obesity or are overweight. In fact, the NIH randomized controlled trial in 2019 by KD Hall showed that there was increased proportions of this ultra processed food in the diet, which was linked to this increased risk of the pandemics of obesity and diabetes, along with hypertension, stroke, and coronary artery disease. So this was a wide study over 19, covered 19 cohort studies from countries including Europe, the United States, and Brazil. So we have sufficient data, and if we need to sort of prevent the epidemic of these emerging endocrine diseases, we need to encourage the front of package labeling. We need to, in fact, control the marketing and brand promotion of these products with effective front of package labeling, and so that we get a positive brand image, especially for the green manufacturers. And these need to be based on the guiding principles from WHO. There are 5 principles. I'll not go into details because I think Dr. Sunila Garg madam would be taking more details on this. But I need to just point out 2 success stories, one from Chile and the other from France, 2 countries across the Atlantic Ocean, one from South America and the other from Europe, where Chile adopted strong mandatory regulations of FOPL in 2012. So they adopted these warning labels of high sugar, sodium, saturated fats, and calories. And this has already shown significant shift in social norms and attitudes towards purchasing nutritious foods, because the labeling system is relatively simple, and this impacts people across different socioeconomic strata and education levels. And in fact, it has led to manufacturers reformulating some of their products based on consumer preferences. So people are now aware, and this has been a success story in Chile. Similarly, in France, where 2017, this voluntary FOPL system, they used the Nutri-Score rather than the warning labels. And they had positive scores for fruits, vegetables, nuts, fibers, and proteins, while negative labels for calories, sugar, fats, sugars, and sodium. And this has also been a relatively success story, and this has been endorsed in France, Germany, Belgium, Netherlands, Luxembourg, and Spain. So the other European countries have joined in, and it's been found to be effective for educating and informing the nutritionally at-risk individuals. So some of these success stories are already there. And India, where we just discussed that 1/3 of the population is youth. So this would be very effective, because India is at the cusp of a food packaging revolution where retail plus the agribusiness have already created full vertical integration of the food value chain. And urban and rural poor across, they are consuming these increased amounts of processed foods. And the consumption of these foods is being backed by billions of rupees which are spent on marketing. So this drives the youth being attracted to these foods. So if we can change the marketing or control the marketing and bring on mandatory FOPL in local languages or image-based, this would actually encourage consumers and encourage industry. So we need to involve academia and groups, and today's session is an effective step in continuation to the previous ones to sort of add to this. The challenges are immense with regards to Indian diversity, food industry, which pushes back, The hesitancy from policymakers is gradually waning, and we are on the cusp of taking effective steps in India. There is, however, a subtle consumer pushback. So how can we sort of affect this? Because we know Indians have a sweet tooth. If we see the sugar consumption in the US, and if you look at, say, the 19th century and we look at now, we see the tremendous increase in consumption which has happened. And if we look at growth in Asia, we see that India tops the list with annual growth of 4%, where the world sugar consumption grows at 2%. And India's domestic sugar consumption requirement is touching around 30 million tons. So free sugars is what we need to avoid. Sucrose predominantly, but there are other naturally present sugars, including honey, syrups, and fruits. Sucrose, which is the common table sugar, has taken over with the advent of industrialization and because of the consumption of processed foods. So this added sugars versus natural sugars is the biggest difference which we need to target for our youth and make aware for them this big difference which is there. In fact, the American Heart Association has sort of given a guideline with regards to maximum amount of sugar consumption. And this is for teaspoon sugar, not the usual tablespoon which we have. So it's 9 teaspoons per day for men and 6 teaspoons for women. But if you look at the drinks available all across, even one drink sort of leads to 4 to 6 to even 9 teaspoons. So just consumption of one drink, such drink. And it's not only these the original soft drinks, but you even have these sugary milk-based drinks, sort of promoted as healthy drinks. All across the board, they contain high amounts of sugar. So in fact, sugar is now it's the new cigarettes. It increases insulin, which increases fat storage, and it has been found to be addictive. In fact, in an animal study, 93% of lab rats chose sugar water over cocaine. That's how addictive it is. So that's what we need to keep in mind. Right. So if we look, these were PET images which were done. It was seen that they lit up to the same amount as the brain of cocaine addicted individuals. So that's how addictive it is. In fact, one interesting thing, I put an image here. This was from Sri Lanka. The organizers there for a conference had put out these sugar pouches everywhere. So this was an innovative way of creating awareness that sugar is addictive and causes diabetes. So these sort of innovative steps can be taken up everywhere. This is another from the Boston Public Health, the traffic light sort of system, where they say they have highlighted drinks with red, yellow, and then in green we find water predominantly or skimmed milk. This was our data which we had presented at the International Diabetes Federation in Dubai, where we found that reducing free sugars and moving to these non-nutritive sweeteners actually impacted taste. And we know that we as Indians are addicted to sort of taste, especially sugar, salt being added on, and lack of taste becomes the biggest impediment. And when the policymakers or the industry switches to healthier foods, that is the biggest challenge of how to sort of bring the youth to choosing healthier foods without their taste becoming affected, because that's the biggest impediment for switching over to that. In fact, over the world, and this is from the US, we find that obesity has continuously increased despite increasing consumption of non-nutritive sweeteners. So even when population switched from sugars to non-nutritive sweeteners, the obesity persistently increased. And this is because with the use of non-nutritive sweeteners, they were consuming a lot of ultra-processed foods which contain a lot of fat and other calories, which sort of compensated for it. So I'll just sort of summarize here as to the challenges, because eating becomes an individual choice which gets influenced by individual consumers based on taste and food marketing. And we know that food industry gets driven by profits, and their aim is to hook consumers on tastier foods, even if it means the ingredients are unhealthy. So high amount of salt, sugar, fat, which is making the food tastier. So doesn't sort of, I mean, they're looking at profits only, but ultimately it deprives our youth of their money, health, and freedom to choose the right food. And they sort of become manipulated by the taste, marketing, and that's where the choice gets sort of misdirected. So we need to incentivize the consumers, bring in strong marketing controls, effective front of package labeling. We need to avoid this stealth and overt reformulation which marketers bring. So lots of vitamins, but lots of fats and sugars, and involve public-private partnership to give the right direction. In fact, this is Richard Thaler and Cass Sunstein. They brought out a book on nudging, nudge. So using the ideas of nudging can be a way forward to direct a youth to the right path. Nudges, in fact, are very low cost interventions and generate less resistance from consumers. We had nudge advisors to Barack Obama and to the Prime Minister of the United Kingdom. And Richard Thaler has also won the Nobel Prize in 2017. So that could be an effective way forward to sort of encourage the youth, direct the youth to choosing healthier options. So I'll end here. Thank you. Thank you for a patient hearing.
Thank you so much, sir, for throwing light on this important and yet less spoken topic. You have made a beautiful use of slides and pictures, which kept the session very interactive. Thank you so much, sir. Now, to help us understand more about FOPL and what is the role of FOPL in preventing the NCDs among youth, we have with us a very eminent personality, Dr. Sunila Garg, ma'am, the immediate past president of IAPSM. Ma'am was former head of Department of Community Medicine at MAMC. She has served in the field of public health in various capacities, including her role as advisor for National Institute of Health and Family Welfare and Indian Council of Medical Research. It is a privilege to learn about FOPL from a great personality like ma'am. Welcome, ma'am. We are eager to learn from you.
Thank you, Dr. Venkatesh. And I was listening with keen interest from Dr. Joshi and Dr. Mittal, and I believe earlier Dr. Bhardwaj spoke, and I missed him because I was, on my way from a concluding meeting of, which we are holding for the first time for CGHS officers, their leadership skills and all that. So, but you see, one thing which you have to keep in mind is that, can I share my screen also?
Yes, please, ma'am.
So basically, you see, one thing which we have to remember is that we cannot forget the fact that we have all over the world, obesity is increasing. And particularly it's the...
sorry to interrupt, ma'am. Slides are not visible.
Slides are not visible. Just Is it visible now?
Yes, ma'am. Yes, ma'am.
Okay. And then I have to see whether they move also or not.
Ma'am, you have to make it a full screen, like.
Yeah. Is this moving now?
Yes, ma'am. Perfect. Perfect. Perfect.
Just a minute. So primarily, we discussed, as far as I was listening to earlier two speakers also, and Dr. Mittal also very beautifully touched upon, the front of package labeling and all that, and how he gave the example of Chile and, France and other European countries also. But you see, and also I was listening to, Dr. Joshi, who talked about how we can make use of the systems, how we can empower the youth, in, making the ambassadors of change, that, they can talk about healthy food choices, they can talk about, and also to add upon, I can say that they can talk about exercises, they can talk about, another part is about the balanced diet. But one thing which you have to remember is that though different programs, have tried to involve, like Rashtriya Kishore Swasthya Karyakram and all that, they have tried to, focus on youth, but most important is how to empower youth, because our country is very diverse. And we will, need, in Indian context, we will need, some kind of a, labeling, which will, help, and it will percolate to all segments of society. We are not, all of us are not, the same urban elite, or there are quite a substantial number of us, they belong to rural background. Then, there are people, who are the change makers, like our frontline workers who are serving at the grassroots levels, like Ashas or Anganwadi workers. Sometimes when they will visit the house, basically people are going to ask them that, is this packet healthy? Is this packet, like quick foods, particularly when we talk of foods like Maggi, or, the quick foods which will give us, the instant energy and all, they're rich in sugar. But how the community knows. So that is where we need to bring in innovations with regard to, labeling as well. Because we know that front of package labeling is going to provide quick and straightforward information to the consumers to identify food and beverages which are unhealthy. And, it's a part of comprehensive health policy needed to promote healthy diets, reduce overweight, which is very, very important, obesity. And we all know that particularly most of the, NCDs, the root cause lies in basically our diet and subsequently our lifestyle, sedentary lifestyle, which leads to, kind of couch potato syndrome and all that. And plus, lack of exercises. That is another important thing which you have to keep in mind. And I think this part was basically shown also, but what I would like to cover is that primarily food industry is not in, interested in this kind of labeling, that it is a toxic food, it is this kind of food and all that. And that's why when I was listening to Dr. Mittal and earlier to Dr. Joshi also, they said that they will pick, put big things in front, but the actual thing they'll put in very small letters behind the labels. That is important. So we have to look at what is there behind the label. So front of package labeling regulations, they represent a key public health measure to promote healthier food environments and address non-communicable diseases. So this is the dialogue which we all have to have with the food industry, whether it is IMA, whether it is, IAPSM, or it is, Indian Academy of Pediatrics, or, Association of Physicians of India, or together I will say, because I was president for organized medicine at my guild also, we need to have comprehensive dialogue along with WHO, which we started in 2011, but so far also we are struggling hard. So among the existing FOPL labels in nations with high rates of NCDs, warning labels have been proven to be effective, as was mentioned earlier, in changing consumer behavior. But remember, behavior change communication is something very difficult and very, very challenging also towards healthy decisions. So warning labels, they help the consumers quickly and easily identify, which we all know that ultra-processed food and beverage products hence to be, referred as UPP, which are high in sugar, sodium, and fat. Another thing, so we are worried about what are the nutrients of concern. And we know that there's large body of evidence on linking these nutrients, which have been mentioned earlier. We should have information about total calories, saturated fat and trans fat, sugar and salt. That is important. And another thing is that mandatory declaration of all these items is necessary, which will contribute to, and the percentage contribution to recommended daily allowance on the front of pack label. So, we have two parts. You can see that, part one can talk about energy, trans fat, total sugar, and salt per serve. And part two can talk of per serve percentage, its contribution to recommended daily allowance. Now, how do we calculate this? So calculation criteria per serve percentage contribution to RDA is based on, recommended daily allowance is based on 2000 kilocalories energy, 67 grams of total fat, 2 grams of trans fat, 50 grams of sugar, and 5 grams of sodium chloride. Here you can see that when we talk of total sugar as 16, but where it is, about 32. So it is, labeled as red. So that is important. So high fat, sugar, and salt should be colored red if energy from total sugar is more than 10% of the energy provided by 100 grams per 100 ml of the product, or energy kilocalories from trans fat is more than 1% of the energy which is provided by 100 gram per 100 ml of the product. Total fat and sodium content are more than, the threshold value, then you label it as red. So what is the, challenge of FOPL? Recently, we know that, ultra processed processing food industry has shifted its stance from outright opposing FOPL to seeking, to weaken the policy standards and requirements. Whereas, the governments have approved FOPL, industries are attempting to delay implementation and avoid compliance through multiple tactics. In 2021, the Global Health Advocacy Incubator, they monitored this industry's attempts to weaken FOPL standards in 20 geographies, and this report highlights the actions and narratives by the industry. So I will recommend that one should go through this report of Global Health Advocacy Incubator 2021. So this corporate playbook is composed of 4 main strategies. One is that you protect the UPP industry's reputation and brands through corporate washing. That is number 1. Influence the policies through multilateral bodies to delay implementation and threaten the countries with legal and economic concerns. That is important part which you have to remember, that these food industries are very strong and they are also aiming to divert attention. Though they focus on that theirs is a corporate social responsibility, but they tend to divert the attention of the corporate social responsibility on the damage to environmental and human health to blame individuals for their behavior. So remember that they're talking about the behaviors, not about the product, and imply that the products contribute to health, the environment, and society while blocking the development and implementation of healthy food policies. So this is where we need to talk about that this corporate playbook is, basically flying around, or it is toying around these 4 important things. So, we have to be beware of the corporate washing as well. So another thing which is very important is that every time you can see that, as earlier also it was shown by, Dr. Joshi and I think Dr. Mittal as well, he showed that, how front of package labeling will catch the attention of a young mind or an individual is that in the front you write whatever, in a big way, but on the back it is written in such a manner that nobody can make out. And then also, they use different narratives, arguments, symbols, and actions are used by the UPP industry to position and protect its commercial and financial performance. Because this is what no industry is, going to agree to the fact, and we have to be very smart as, the health ambassadors, that this is where we do not get into the, trap of the food industries, and we need to go straight in terms of, what is front of package labeling. The industry performs multiple brand washing activities that capitalizes on the social, economic, nutritional, health, gender, cultural, and environmental causes. So in Israel, basically UPP-friendly shelf dispensers strategically have been designed to hide or sabotage FOP labels which have been detected. So that is important. Another thing is that by co-opting multilateral bodies at global level, regional level, local level, the UPP industry guarantees, the normative frameworks and context that allows it to expand its agro business and avoid and weaken the regulations around healthy food policies. So that is where we need to have in black and white what are our healthy food policies, and this is where monitoring will play a critical role, so that at no point of time we can weaken the regulations which are surrounding around the healthy food policies. That is important. Another thing is that even though corporate practices have globally shaped unhealthy food environments, the industry also fails to take any responsibility for the environmental and human health damage they cause. So this is where one can play a very, very important role while having a dialogue with the food industry. So while promoting freedom of choice arguments publicly, corporations and their allies, they put the burden of NCDs on individuals. They avoid liability and challenges and they challenge public health laws and policies worldwide in order to protect their interests. So another thing is that the industry also assigns unique attributes to UPP to build, loyalty and guarantee consumptions over a period of time with special attention on children. Remember that this is where we have to be very, very cautious, because these UPP industries are basically ultra processing products, food industries. They are capturing the population, which is majority of it is a childhood population. And then also, it highlights these product characteristics and companies. They often use their relationships and multiple tactics to cast doubts and confusion around the evidence and effectiveness of public health measures. So this is where we, as I said, that we need to have our policy in black and white. Now, if we look at the example of Coca-Cola South Africa, one of the biggest sugar sweetening beverages company, ironically, it committed to tackling NCDs, particularly obesity, and to create healthier food and more sustainable food environment. So this is what is written on top, that Coca-Cola is committed to in actions that will support healthier food environments. Now, in what way? This is what we have to see, because Coca-Cola has not gone out of our lives. So this is where we see that how ironically they are committed to tackling, whether it's only, if the brand is there, the product is there, we will not be able to solve the issue. That is important. So already, the Chile case study has already been mentioned. Primarily, they talk about, they mention about the calories, they mention about the saturated fats, they mention about the, the sodium content, they mention about the salt content. So Chile case study mentioned about all food and beverages which exceeded the limits were or are required to have a front of package black and white warning, which message reads that high in, that is important, that high in salt, high in calories, high in fat, that is important, which is followed by nutrient exceeding in limit, as well as, and it is endorsed by Ministry of Health. So studies, this is one of the important studies which has demonstrated that, FOPL has worked well. And Chile has mandated, basically high in warning labels considered the golden standard FOPL, which restricted sale marketing to children. Remember, this was very effective for children, and banned in school the sale of packaged food. This is what in Indian context also we need to do. And this is what is a critical role of professional association, where IIMS got a very critical role to play. And we need to do the school audits also in this regard. So, we have to ban the school sales of packaged foods and beverages, having basically, HFSS black octagons with the words high in sugar, sodium, saturated fats and calories, whichever applies, by making FOPL mandatory. And already we have got the example of Chile in front of us. Now, another thing is that basically this paper was also published, in PLOS Medicine, that is evaluation of Chile's law of food labeling and advertisement on sugar sweetened beverages purchases from 2015 and 17, which shows that, afterwards we knew that, if you can read the conclusions, that purchases of high in beverages significantly declined following implementation of Chile's law of food labeling and advertisement also. Now, another thing which is important is that in India, we have got food safety standards, which is regard to packaging and labeling regulation 2011. So Food Safety Standards Authority of India has undertaken revision of existing packaging and labeling, and it has been split into 3 separate regulations as under. First is that draft packaging regulations are there, draft advertisement and claims regulation, and draft labeling regulation. So this part is in red, because this is something which needs to be reinforced from, Food Safety and Standards Authority of India. So you see, it aimed at establishing requirement for, FSSAI, it aimed at establishing requirements for labeling of prepackaged food to provide simple, easy to understand information to the consumer and facilitate them in making healthier food choices. Prescribed requirements for front of package labeling, which includes, labeling of energy, total fat, trans fat, total sugar, and salt on front of package, along with their percentage contribution to, RDA and HFSS labeling. This is very, very important. So we have to have mandatory declarations of this, which I already mentioned. So and on the, back of the pack, as has been demonstrated by FSCI, these all informations, they need to be, mentioned, and they need to be mentioned in bold. That is important, and including micronutrients and minerals and vitamins also. But nutrients and micronutrients should not divert us from the fact that we are compromising on energy, protein, carbohydrate, sugar, trans fat, and all that. We have to have the complete information. That is important. So, basically, in 2018, FSSAI published a draft regulation on front of pack nutrition labeling and made them available to public online. And it considered different symbols, nutrient profiling models, and it proposed a format based on nutrient level cutoffs derived using the recommended RDA allowance for children. But what is the story so far? In 2018, after multiple discussions, FOPL was shelved out by FSSAI, probably due to pressure from the industry. This is where all of us have to have a continuous pressure from professional associations on FSSAI. In 2020, again, the discussions have been revived in a positive way, and working group is, working on the development of nutritional cutoffs and label designs. So again and again, we rework our strategy. In 2021, FSSAI is closing on FOPL system, and we as public health community should advocate for a strong interpretative need-based FOPL in India. Why I say need-based? Because our country is very diverse to reduce mortality and morbidity due to non-communicable diseases. So another thing is that basically, as of now, whatever, what labeling we have, that is aimed at only literate and who are nutritionally aware. Almost a quarter of our Indian population is illiterate. Therefore, pictorial representation will allow better engagement and understanding. It is crucial to have a positive participation of the food industry and of society as well. Unfortunately, Indian food industries have expressed many concerns, but this is where we as, I'll say, important stakeholders from the health community need to come forward. Over the, basically we need to work on a format which is because one size is not going to fit all. That is important part. And then, though color works well in, in Indian settings, but then, I also feel that one color should not deteriorate everybody from buying that. But over a period of time, which I've seen, the industries have started doing in different countries. And then, if they mark it as red color, they should have a, it is a warning for the industry as well, that they need to reduce the proportion of that content as well. And our industry's argument is also that positive and voluntary labeling is accepted in many countries and should be encouraged in India, whereas the need of the hour is that front of package labeling should be using the consumers and stakeholders input. That is important. So another area, basically is to, we need to see that what is being dished out to our children on the TV screen, because what they are going to see, as I said, that our food industry is very strong. They target the children, and that is where they become, kind of, I'll say, our parents also, are carried away by this. So knowledge of parents is also equally very, very important. So according to various reports, the food industry, as I told you, is eyeing on children, and children now see 33% more fast food TV ads as they did 6 to 7 years ago, while preschoolers see 21% more, which is alarming. Measures such as FOPL and marketing restrictions, I'll say the second one is more important, the marketing restrictions. These are few solutions which can address the diet-related disease epidemics, and we need to focus on behavior change communication as to slowly how to change our behavior from, these foods to, the healthy diets as well. So world over, countries are prioritizing such actions, and India is also in the process of taking a step in this direction to build nutrition secure and healthy future. So our way forward is front of package labeling supported by public education of both adult and children. We need to focus on nutritional literacy. And FOPL regulation should be framed as per consumption practices of the individual country. There is a need to generate awareness about critical indicators like color, size, taste, flavor, nutrition level, calories, etc. Good publicity in social and print media to emphasize the importance of nutrition and FOPL in regular food choices. And as I've been telling you, the role of professional associations, including IMA and Association of Family Care Physicians of India and WHO, is very crucial in form of having a dialogue with the industry and issuing advisory to the government. Thank you so much. Thank you.
Thank you, ma'am. Thanks a lot for the clear and crisp talk on FOPL, ma'am. We are glad and thankful that you spared your time amidst your busy schedule. Thank you so much, ma'am. So we are nearing the end of the session. Let us take few questions from the audience. Audience can please start typing their questions in the chat box. In the meantime, I request you to fill the Google Forms, the link of which will be pasted in the chat box now. Also, we will be mailing you this form to everyone. Please note that certificate of participation for this webinar will be provided only after the submission of the Google Forms. The recording of the session will also be mailed to you within a couple of days. So let's come back to the chat box. We have a few questions in the chat box. Like Dr. Palash Rakshit has asked, is FOPL under CPA? Integration of food industry with pharma industry, what is the significance? So can someone answer? Can Dr. Pradeep sir answer for this?
Yeah, Sunila ma'am is there. Ma'am?
As of now, it is not under Consumer Protection Act, but this is our endeavor to bring it under that so that, you know, everybody has a right to know what is there. And this is what I said is the dialogue going on, you know, between the organizations, I'll say the food industry, as well as, you know, our own stakeholder, that is Ministry of Health, and along with FSSAI. As of now, it is not under CPA.
Okay, ma'am. Thank you, ma'am. We have another question from Dr. Mayank Badola. He has asked, monosodium glutamate is no longer written in labels, but has been replaced by a alphanumeric code. How can public identify what they are consuming? Our chief secretary has moved a letter to use regular nomenclature, but we need more transparent way of telling consumers what they are being offered. What does the panelists think about it? Can someone take up this question?
Dr. Madhukar, can you highlight on the topic?
Maybe Dr. Joshi or Dr. Mittal can also.
Yeah, I think that's been the focus of today's session. In fact, Dr. Sunila Garg ma'am also focused on that the front of package labeling would solve many of these issues. Now, the only thing is what to highlight in the front of package labeling. That needs to be taken as a policy decision as to what significantly needs to be put as images or text or some various methods that needs to be chosen effective with regards to our diversity. So I do not know the current status about the government moving forward in this direction, but I'm sure there is some movement. Maybe Dr. Sunila Garg ma'am would like to add on to this. But definitely what labels we can add, we need to choose whether monosodium glutamate needs to be added, but we know that sugar, salts, fats, these need to be considered.
Yeah, thank you, Dr. Mittal. I think these are the basic things at least which need to be added. As I told you that, you know, there is a continuous dialogue between WHO and professional associations, NCD association and all with the food industry. But somewhere, you know, along the line, as I said, I showed you different labels also that they will put something in the front, but, you know, the actual information is not there, you know, and it is written in very small letters. So that is where, and another thing is that when they show these products on the TV channels and all that, they're going to show only the front part. They don't show the back part. So this is where we have, you know, ignorant parents, we have ignorant even teachers, we have ignorant even, I'll say the ignorant healthcare providers also. So that is where we need to take this information in a big way so that we are not caught away in the tactics of food industry. But this dialogue is already open and we can make a lot of difference. Thank you.
Thank you, ma'am. Ma'am, we have a few more questions. A participant has asked, how to India comprises of large rural sector. How can we make FOPL more inclusive for villages who are alien to terms like trans fat, sodium contains, etc.?
So that's what I was saying. We need to have a kind of a, I think other people can add, but, in my own experience, let's say if I have to, go to a front line worker who is there in health and wellness center, where we talk of the concept of wellness now. So, even she has to understand that, what does this packet of chips or noodles or, they're going to ask about these packed foods. What do they mean for that? So if it is colored, then it makes at least it will make a difference. People do understand colors in a better way. And our endeavor should be, first to educate these workers and ultimately, also sensitize our teachers. That is important. And they can do the practical demonstrations and see the canteens as well, that what is there in the school canteen and in a simplistic manner. Because if we say that this is, color is easily identified, and that is where, as a chilies example, which I gave you, the marketing of these products has gone down. And then, industry rethinks up, in terms of, how much, whether I need to moderate the sugar levels, I need to moderate the salt levels and all. But color coding is going to be a better, better in respect of, Indian settings, because that, I think it helps us in understanding.
Thank you, ma'am. Ma'am, though we have many questions, we'll take one last question due to lack of time. Dr. Ramavdar has asked, how can we identify labeling errors? Can any of the panelists please answer?
Can anybody answer? Yeah.
Just to add on that, the FSSAI have released a guideline of a standard draft guidelines, basically regarding what a label should be and what information it should have. In case any consumer finds the label is not as per the requirement of Government of India's draft policy, they may send a copy of the same to FSSAI for addressing the issue, because every product is being licensed by FSSAI before it comes in the market, be it your butter, be it your chips, whatsoever. So FSSAI logo itself gives a license to them to market and sell out the product in the community. So just draft guidelines can be visited on the website. Ma'am, back to you, ma'am.
Thank you. There are very good FSSAI guidelines. In fact, there is a booklet on that, which is very simplistic, which talks about, the endorsement by FSSAI. And if any consumer has any doubt about that, they can go back to that. That is important thing. Because as I said, that these are one of the critical factors which contribute to obesity and, also to non-communicable diseases. So ultimately, we have to look at, our labeling pattern, our guidelines, and if somebody has got doubt, we can get back to FSSAI also.
Thank you, ma'am. Thank you so much for patiently answering the questions. Due to lack of time, let us move to the last part of today's session. For this, I would like to welcome the brain behind this event, Dr. Pradeep Agarwal, sir, Associate Professor, Department of Community and Family Medicine, AIIMS Rishikesh, to deliver the vote of thanks.
Thank you, Dr. Venkatesh. A very good evening to everybody. First, I'm really happy that we are able to hold the youth, the energy. The Government of India says, Honorable Prime Minister says, we are the future. We are the torch bearer of the change. And through this webinar only, we just want to give you a sensitization regarding a big policy change of FOPL. So a voice campaign need to be taken up at a youth level to address the non-communicable disease, and FOPL is one of the measures that can be adopted. My special thanks to our organizers, that is from the World Medical Association, Professor Ravi sir, Professor Jayalal sir, and my special thanks and giving the permission to coordinate with AIIMS Patna, Professor CM Singh sir. Ma'am have been always a brain and a force of motivation to conduct such kind of webinar. Ma'am was yesterday in Gorakhpur. Today morning she is in Delhi, and right now, immediately after a meeting, she have enlightened regarding the topic. This topic is very close to the heart of ma'am. Since last 1 decade, ma'am have been working on the topic and guiding Government of India to adopt the educate policies. My special thanks to AIIMS Jodhpur team, Professor Bhardwaj and Professor Mittal. Their presentations have been very informative, to the point, and have given a well orientation regarding FOPL. The youth can know one else can address better than Dr. Shiv Joshi, addressing not only the youth, but giving them an insight how they can act as a change. A special thanks for inception of the idea, Dr. Om Prakash Bera. Currently, he is not able to join, and most of the trend have been taken up by the ma'am. So we are not going with the journey so far. And my special thanks. The main energy representation of this webinar is the youth, and the youth represented by Dr. Venkatesh. Thank you once again for giving an extra time. And I hope we all are going to meet soon again and do respond to the webinar. Last concluding final remarks from the ma'am.
Thank you so much. I think continuously, if we can, have dialogue on this, I'm sure, we will be able to make a difference. And thanks to Dr. Pradeep for holding number of sessions. And in morning also, I was discussing that we are yet to reach this part of the country and that part. So that's where, and ultimately we need to go to the colleges and schools also to create awareness. So that our important stakeholders are also, there in school. So that's where, like yesterday when I talked about tobacco, there also, it was, we need to focus on important stakeholders. So food is a very important product, and the basic cause of non-communicable disease, along with the sedentary lifestyle and whatever it is. But we somewhere need to focus on the media as well. What media is showing, how, and how much, and if we increase the taxation and we increase, the kind of value to that ad, or I say make it more expensive, somewhere there has got to be I'll say what comes in media also has got to be regulated. So that is where it is important, because that is how the children are lured also. Even if, they will not take permission, but whatever pocket money they will buy this food stuff also. But, in the end, I'll say that, my profuse thanks to you, Dr. Pradeep, and to all the speakers who have been there over here, and wonderful presentations they have made, because I came very quickly to join because this topic is very close to my heart. So I said that yesterday I called up Dr. Bhardwaj. I was on my way back and I said, maybe is the session on? He said the session is tomorrow. So that's, kind of. So thank you so much. And I'm sure that all AIIMS faculty across has taken a big lead. And thank you, Dr. CM Singh, also, if he is there. So, and his team who has taken a big lead also. And Dr. Pradeep, you are the torchbearer, I'll say that, along with Dr. Om Prakash and all that. Thank you so much.
Thank you so much, ma'am. Thank you so much, sir. Once again, I thank Dr. Ravi sir, Dr. Jailal sir, Dr. CM Singh sir, Dr. Sunila ma'am, Dr. Pankaj sir, Dr. Shiv sir, Dr. Madhukar sir, Dr. Om Prakash sir, Dr. Pradeep Bhagawal sir, and more importantly, to our wonderful 1,800 plus registered participants. Around 400 to 500 of them were continuously present throughout the session. Thank you so much for making this as a grand success. We will be sharing the certificates and recordings of this webinar in a week's time. Thank you, everyone. We are closing now.
Thank you, Venkatesh. Thank you for
and a special thanks to Clarinet.
Yes. Thank you so much, sir. Thank you. We'll be looking forward for such more comprehensive sessions from your end and the webinars that you are conducting. And we'll be very happy to be the digital partner again in near future for such webinars conducted by you guys. Thank you.
Thank you. Thank you.
Thank you.